Okay, hey, welcome to DIY.Physio. Thanks for giving us a go. This video is a how-to video about how we would like you to perform what we call fascial manipulation, which is the self-treatment technique that your physio will be sending to you. Fascial manipulation is a way of manipulating the fascia, and fascia is, if you think of it like a spider web of tissue that runs from the top of our body right to our toes, and occasionally it can get stuck, if you think of it simply, and it can get stuck through things like sprains or strains or fractures. So they're more acute reasons it can get stuck, but it can also get stuck through more chronic issues like overuse or the sports you play or the work positions that you adopt, the sleep positions that you find yourself in. So the points that you receive in your information from your physio are going to be directed towards what symptoms you've reported. So when you find your points, we want you to effectively think about sticking your knuckle, your elbow, or you can even use a little tool such as this. You're going to find the point, and what you're looking for is a sharpness to pressure and a little bit of a thickening in the tissue. Not all points have both of those features, but if it has a sharpness when you apply pressure and feels a little bit thick, and as you start to slide and glide through the tissue, you might start to notice that it's a little bit stuck, then that's really a good point that you've found. Once you're on the point, we sink in gently to the deeper fascia. We're not trying to skim the skin, we're trying to sink to a deeper layer, and once we've found that deeper layer, we're going to think about exploring the zone, looking for sharpness and looking for thickness. Once you've found a nice spot that feels sore and sharp, we start to manipulate it. So we apply pressure and we start to glide the tissue. Initially in one way, it's good to get a feel for what the tissue is doing. Does it feel like it's snagging somewhere? Once you've been doing the manipulation for a little while, you can change direction. You can go cross friction or in the opposite direction. And as the tissue loosens up, you can start to do some circles, clockwise or anti-clockwise. Now, what most people report initially is a spike in pain over about 3 minutes. The pain can actually get worse, and it can actually refer into your zone of discomfort. Try and stick with it, because around about the 3 to 4 minute mark, you should experience a dropping of that pain significantly in about a 10-second to 20-second window. When you feel that dropping in your pain, you'll also notice the tissue actually starts to slide very easily in all directions. So you can just keep going until you feel that that tissue is sliding and gliding easily in a lot of different directions. That's when you know you've had a really good release of the local zone, and at that point it's a nice idea just to retest the movement that was causing you the pain, and then you can move on to your next point.